West.
Dr. Farid Fata took an oath to do no harm. He did the exact opposite, harming patients by the hundreds in order to bilk the healthcare system out of millions, pocketing close to $20 million.
Fata's crime? Intentionally misdiagnosing more than 550 people.
We have seen patients who have organ damage, patients who've lost teeth, who have nerve damage, who have serious damage to their immune system.
Hey guys, welcome back to my channel here. It's Lavender here, and today I want to do another true crime case. Today I'm doing the true crime case, Farid Fata poisonous chemotherapy scam on the victims of capitalism. So let's get started into this true crime case video. So this case has been featured on a number of media and TV. It has been featured on the American Greed Show. It's on season 10, episode 18. And I think it's called Blood Money. And then it was featured in Oxygen's Deadly Power. It dives into the crimes of Fata. Also, it was the subject of season 2 of the Dr. Death podcast that was released in 2020. Okay, so on to the story of this scam on the victims of capitalism. So a Michigan doctor, Farid Fata, he was like a Lebanese doctor. He treated cancer-free patients with poisonous chemotherapy while taking in millions of dollars in payment like a typical capitalist pig, while the victims of capitalism suffer the consequences. Because they are victims of capitalism. Because you know why? Because like the healthcare industry in the United States is such shit, and then on top of that you have doctors scamming people and doing stuff for money they don't need to do. You know, because capitalism puts profits over human lives. You know, capitalism puts profit over anything. So yeah. Concerns about Fata cropped up as early as 2007 when Maggie Dorsey sued Fata for malpractices in his office. She had been diagnosed with cancer in 2004, and 7 months of chemo had made it difficult for her to walk. She then learned that she did not have cancer in the first place. The case was settled out of court in 2009 and 2010. Veteran oncologist nurse Angela Swanky went to MHO for an interview, but she was stunned to see practices that her experience told her were plain wrong. She believed that Farah was pumping patients with drugs specifically to bill their insurance for more money, a classic fraud scenario. She complained to state authorities about the fraud that was going on with the doctor, but got no response until 2011 when she got a form letter saying that there's no hard evidence to support an investigation into this fraud. In 2013, Fata diagnosed 54-year-old Monica Flagg with multiple mastomas, a condition that requires a lifetime of chemotherapy for the rest of her life for her to have any chance to survive or live. On July 1st, hours after her first round of chemotherapy, she broke her leg in 2 places. Fata was on vacation in Lebanon at the time. One of the doctors at MHO, So Maglande, saw her in the hospital that day and was stunned to see her readings were completely normal. As he put it, he could tell just by looking at the chart that Flagg's numbers were not consistent with an active cancer patient, you know, another sign of red flags and another sign of a scam crime going on, a true crime, going on. The next day, Malay went to Fata's office clinic and reviewed Flagg's records. He could find nothing in Flagg's test results that could justify a chemotherapy regimen. He later told the Detroit News that melanoma can start with minor changes in blood chemistry, minor enough that a dishonest doctor can use chemotherapy to avoid detection. He estimated that if another doctor had seen Flagg within 2 months, she would have appeared to be in remission. He also believed that since Flagg was far healthier on paper than the typical melanoma patient, the insurance payments would continue flowing to Fata for the rest of his life. Mandungle went to see Flagg the following day and told her she did not have cancer. He further advised her to get her records right away to find another doctor in the area, and that she should never go back to the scamming Dr. Fata again. Maldale was already due to leave MHO the following month after catching Fata red-handed lying about the clinic's enrollment in a professional quality program. However, after discovering that a perfectly healthy woman was being treated with chemotherapy, he felt the need to stop Fata, knowing that Flagg's case, even as egregious as it was would not be enough to shut the scamming doctor down. Fata, he needed to find more evidence of misconduct in his office. Mal Dungley investigated MHO's patient records and found numerous instances of unethical and potentially illegal behavior. For instance, the doctor was treating several patients with IVIG, a drug intended to treat patients with specific immune deficiencies. When there was no apparent medical basis for it, they persuaded a nurse and a nurse practitioner to confront the doctor. When the doctor agreed to curb the use of IVIG, Megdon believed that this was further evidence that Fata was a fraud. Later, he told the news that an honest doctor would never cut back on his own protocol solely because of staff and psychiatrician objections. Weeks later, the Federal Bureau of Investigation stepped in on a tip from George Kowalski, who was the office manager for the doctor's network of clinics. The office manager grew suspicious after clinical staff and other doctors in the area began giving their notice without explanation and leaving the doctor's practice. When asked Millie why he was leaving, he told them that the doctor kept insisting on aggressive chemotherapy regimens, even for patients who didn't need it at all. Kashi did not believe that Mealing at first, since he was aware of other clinical staff who provided care and oversight. However, they later changed their stance and recalled that many nurses and others have expressed concerns about the doctor's aggressive regimen and scamming behavior. He conducted his own investigation and interviewed several staff that were in the office. First thing he noticed was that Fata's treatment to consultation ratio was different than other doctors. Kershaw went back to Maldely, who suggested that Kershaw check on Fata's use of IVIG. Kershaw asked a nurse, and she did report that she discovered in 1 week 38 out of 40 patients did not need or did not qualify for the drug. The doctor was originally held on a $170,000 bond after he got caught for, his fraud, and he was arrested, the day for, healthcare fraud. He was originally held on a $170,000 bond. However, his wife had assets of $9 million, not yet seized at the time, and feared that the high liquidity of these assets could get him bailed out. And he thought that he could be a flight risk because he's from Lebanon. He can just go to Lebanon. So they persuaded a federal judge, Steen Cox, to raise his bond to $9 million. He was confined to jail pending trial. Had he been released, he would have been confined to his home in Oakland Township and barred from practicing medicine. Federal investigators amassed evidence that Fata had bullied or deceived 553 people into getting chemotherapy treatments they did not need, causing the patients, insurance companies, and Medicare to pay him $34 million in fraudulent and unnecessary claims. They also found that the doctor took kickbacks from 2 local hospices and poured Medicare and private insurance proceeds into his own diagnostic testing facility, where he ordered unnecessary tests and stuff, all agreed, because that's what capitalist pigs do. They just want to make money. The doctor's sentencing hearing began on July 3rd, 2015. At the hearing, dozens of his victims, the victims of capitalism, revealed how the unnecessary chemo treatments had affected them. For example, one of the victims, Robert Strawray, nearly lost all of his teeth after being falsely diagnosed with blood cancer, leukemia, and still twitches to this day uncontrollably. Patty Hester lost so much of her hair after being falsely reported that she was terminally ill with mastoplastic syndrome, and the stress of finding out about the doctor's deceit and scam gave her high blood pressure. Another patient called C.C. said that due to 177 unnecessary chemo treatments, she had problems with her bladder, bowel, and kidneys, so serious that she could no longer perform basic tasks. and lives in chronic pain. The outcome was facing the prospect of spending his rest of his life in prison, and if he were to get out, he'd had to be deported back to Lebanon if he were ever released. He pleaded guilty before federal judge Paul Bosserman on September 20th, 2014. He pleaded guilty to 13 counts of healthcare fraud, 1 count of conspiracy to pay and receive kickbacks, and 2 counts of money laundering. In return, the immigration charges were dropped. Nonetheless, McQuaid sought the maximum possible sentence of 175 years in prison. Her office denounced Fata as the most egregious fraudster in the history of this country, calling his crimes even more evil than those of Bernie Madoff. So if you like this video, don't forget to comment, like, and subscribe. Bye guys, next video.